My name is Claire O'Neill. I'm a registered intensive care nurse and head of Clinician Management at Vitality, which means I look after the area of the business that works with thousands of clinicians who are our recognised consultants with us, as well as our therapists. Clinically Speaking is our advisor series of short videos featuring clinical updates and expertise from Vitality clinicians and experts in their field. Each video covers topical clinical subjects, looks at healthcare trends, data insights, clinical research, and the role of insurance within healthcare. A new Clinically Speaking episode will be available every month on the Vitality Advisor YouTube channel. Thank you very much for joining us today, Dr. Tim Rogers. Dr. Rogers is the Clinical Director at Togetherall, the UK's leading digital mental health service and provider of online peer-to-peer support. He is a medical doctor and consultant psychiatrist to athletes in high performance sport. In today's episode, we will look at why a focus on mental health is now more important than ever before. Dr. Rogers, thank you so much for joining us.
That's a pleasure.
It's great to have you. Thanks for your time. So my first question really to you is, what are your recommendations for managing our mental well-being as we enter winter with further restrictions on social interaction?
Sure. I mean, it's a really important question because we know from our experiences of lockdown earlier in the year that there are real effects on mental health as a nation. And those effects come both because of practical things, so the wider determinants of mental health. We know that people's job situations, their finances, and other kind of major sort of determinants of that are changing, but also because of the reality of living a lockdown or living restrictions from day to day and week to week. And although social distancing prevents infection with COVID-19, social isolation can significantly increase the risk of other health problems. And those are both physical and mental. And those things place our emotional well-being at risk at a time when it's really important to look after ourselves in all respects, both mental and physical. And I would say, I guess, so what's the best advice for how we manage that, particularly going into winter when the nights are shorter, it's darker and colder, and so perhaps there are some respects in which it's not going to be as easy as it was earlier in the year. And I'd probably say that a key skill for managing mental health is being self-aware, right? So it's the ability to notice how you are and being and unless you have that ability, it can be hard to do anything about how you're feeling or how you are. So it's great advice, in my opinion, to just take a bit of time regularly to sort of pause and step back and notice how you're feeling during such an unprecedented time. It's important to realise that it's okay not to be okay. So it's a sort of part of being human to feel anxious and to feel low or to feel other things, including whether or not it has anything at all to do with COVID-19 directly. And it's important to say that if you do need support for whatever reason, it's important to reach out in a normal way. So don't tell yourself that you should be strong or you need to push through, or that you need to sort it out sort of single-handedly or alone. I guess that aside, there are some, I like to call them kind of key building blocks of good mental health, and so those are things like sleep and diet and activity, and so it's really important to I suppose think about the things that make sleep better and make sleep worse, find time for good sleep, and when things are tough and when you're having to perform at a high level, often it's okay to have a lot of pressure and to push yourself hard, so long as you make enough time to recover in between. And so not and it's not just sleep that's a part of that recovery, but also activity. I work in sport with professional athletes. However, for the rest of us, it's still really, really important to use activity to maintain our mental health. So, and I think there's an issue to think about as winter comes, because we know that it's going to be colder, it's going to be wetter, and nights are going to be longer. So it's crucial to find ways that work for you to make sure that your activity levels don't drop. And a good guideline is something like 150 minutes of physical activity each week, or maybe a bit less if the activity is intense. And there are lots of try and help you find ways of doing that. And one message is that, any activity is better than no activity, and often any increase in activity is likely to be helpful. And sometimes up to a certain point, there can also be almost a dose-response relationship between how active you are and your levels of mood and how you're feeling. And I suppose beyond activity, it's important to think about sort of social connections, and self-isolation doesn't need to mean social isolation. So being connected to others in a supportive community, does much feel better. The effects of our hormones and the pressure that we feel. And I think during a lockdown in particular, it's so easy to sort of forget to reach out and connect, but it's obviously, I think technology has taught us that it's still possible to experience the same sense of community and connection and the same mental health benefits, digitally. And I think one of the benefits of the era of tech is how readily we can now all do this from our phones or our tablets and our computers. And I think Togetherall, the mental health service in which I work as a digital community, is a great example of that. I think the other side of it is that, however, that technology and tech can also be harmful for our mental health, and particularly probably for younger women. We know that's the case, and it's probably because there are aspects of social media that are difficult. It makes us more likely to make negative comparisons between us and others, and sometimes it's not such a safe or a kind place, and so people can post things or say things very easily that are not helpful for how we're feeling. So I suppose the other side of tech is to just actually take care and notice that whether the way that you use tech is helpful, when your screen time is, and if you need to limit that or change the way that you use tech, then I definitely support that. So rather than just using tech to be on social media, use it to reach out to those people who are closest to you, not just your relatives, but also your wider group, and be together with them online, or friends or whatever. And it's interesting actually giving support that way, so not just receiving it, but giving it can be almost as beneficial as receiving it. And when you do that, take a moment to notice how many different areas of life you actually really value highly, not just your family, your relationships, but friends, other people in your community, and other areas of life like hobbies, spirituality, leisure, physical health, politics, the environment. I suppose all those things, it's important to kind of notice what things matter for you, and what you're kind of, I suppose, really the values you have about the way you live your life. And when we go through stressful or difficult moments, the more we can be in touch with the things that are important for us, the easier it is to kind of navigate life's ups and downs. That's not to say that stress is all bad, right? So a little worry or frustration can be useful, particularly if it kind of nudges us into sort of plan our way through difficult moments. But I think that it's important not to sort of revert to reading the news too much, because I know 24-hour news cycles mean that we miss nothing. We miss no detail of the kind of latest difficulties in the world, and that can be quite tiring and hard to sustain. And sometimes that can increase our levels of anxiety, particularly when you have the Prime Minister standing behind a lectern with bright colours on, with a scary message on there. So I suppose, sometimes in terms of managing that, sometimes you might want to set aside, say, 10 minutes to get up to date with the news at the start of the day, and then for the rest of the day just give yourself permission to focus on something else, like a to-do list for today, or because any more worry about what might or might not happen with COVID, or with a holiday that you booked, or with your job, is not going to be helpful. And maybe the last thing to say is that there are lots of ways, practical ways to help you kind of get back into that moment right now and focus in the present place. And there are often free mindfulness resources online. There are lots of apps and bits of mobile health technology that you can use that can help you focus on the present.
That's brilliant. That's so useful. I'm just trying to take all of that useful information in, because there's about 10 things there. That's brilliant, Dr. Rogers. Thank you so much. I've noted a lot of those things, and I'll be certainly putting those into practice. That's brilliant. It sort of links in as well, because I recently saw within Britain's healthiest workplace survey results that 1 in 5 of us is more anxious compared to pre-lockdown. So my next question to you is going to be, what advice would you give to people dealing with the anxieties of working remotely longer term?
Mm-hmm. Yeah, it's interesting, isn't it? And I think it's been a lot of people's experience, potentially, that initially I would say that different people have experienced it in a different way. And there's certainly been a subgroup of people who have really valued working at home and who very much like that. And that's given them sort of new opportunities to be more flexible. But definitely others, it's been much more difficult. So people, for example, without a place at home where it's comfortable to work, without a sort of quiet space, or without a dedicated desk, or without such good internet connection, or where the technology or other means of working make it harder. And I suppose I think the interesting thing about your question is that we're sort of over that initial phase of adaptation. Lots of people have made an adaptation to that, but now I think what you're asking about is that mobile working or working from home might be here to stay. And so maybe there are actually other adaptations about, well, if this is really going to be how it is for the long term, what do we now need to do? And I think that I read a really interesting article that was written by a former submariner, actually. So somebody who, way ahead of COVID-19, coped by, or had to cope with living under the water for weeks and months at a time. And the article was really focused on routine. So submariners cope by routine. They make sure they rise early, they wash and dress, all the way through to the other aspects of the day that are quite fixed. And I think working from home can be a bit like that, because we suddenly miss out on all the aspects of routine that we previously had. So it might be a commute where we had a bit of headspace to get our thoughts together. It might be the social interaction we had when we popped out to buy a coffee, and potentially so some of those things are lost by working at home, and some of those things are definitely helpful. So I think it's important to look at the routine that you have at home and think about what makes that more healthy for you, or what makes that less healthy. And I guess going back to activity, set yourself a goal to find ways of making sure you're active, making sure you're not sitting sedentary for too long. And I suppose, I guess it's about making sure that the transition from working in your workplace to working at home doesn't rob you of some of the things that supported your well-being in the past.
Yeah, that's excellent. I'm sure lots of people that are listening to this and watching this can relate to most of what you've just said. There's quite a few points I know I certainly have. Yeah, we're in a different world now, aren't we? So we're all adapting. And further, what sort of support is there for people dealing with uncertainty at this time?
Sure. I mean, I think it's important to say that mental health services haven't stopped running because of COVID-19. Certainly there are challenges about demand, but those services are still available. So it's as I said before, if you notice that you're not okay and you need help, then reach out in the normal way, and particularly if at all you ever feel at risk, then it's really important to let someone know. And even if it's not a professional person, it's really important to have someone that you're able to sort of confide that in. And if me saying this now makes you think, gosh, maybe there isn't someone that, or maybe I'm not sure who I'd first turn to, then I guess have a think about that now and decide. But I work in Togetherall, and I think certainly one of the things that has been fantastic about doing that during this period is that Togetherall has definitely been made for a situation like this. So we're anonymous, we're online, we operate out of hours, and so therefore whatever you're going through, whether it's relating to being at home working or anything else, it's always possible to access a community of people who are looking after each other. And I think we certainly saw during the first lockdown that our rates of activity and our sign-ups increased very substantially, and we could see that people were using Togetherall for support during that time and reaching out to other people. And so, yeah, I think it's been really nice to do that.
That sounds brilliant, because actually I watched recently a brilliant TED talk last year, and it was by someone called the clubs, that it sort of relates to what you're saying about people having someone to talk to. Mm-hmm. And he started something called a talk club after he sadly lost his best friend who committed suicide. It was a male, and in this club they encourage men apparently to meet up. He's introduced simple techniques for men to use. So instead of asking perhaps someone, a male friend, how are you today, he's suggesting that we would use techniques such as asking men particularly, how are you out of 10 today? Because he's saying that sometimes men perhaps might bottle up things a little bit more than women perhaps do, and that sometimes they don't just have the language available to them to perhaps express themselves as easily. So, and I've also read as well that the biggest killer of men under 50 really sadly is suicide. So could you tell us about what's being done to encourage men to speak up about their mental health?
Yeah, so it's a really important thing to say, and I think hopefully as a man myself I can talk about this without yeah, but I think it's true. There is science and there are facts behind it. We know that women in the population are much more likely to get mental health treatment than men, and that applies both to medication and also to psychological therapies. And I think there are complex reasons behind that. It's probably there's probably a significant extent to which it's related to stigma. So men are probably more likely to feel like it's weak to ask for help, or to feel like they should kind of push on or be strong. There are also sort of myths about antidepressants and therapy, and so we know there's this general reluctance for men like me to go out and say I'm not okay, and I need some help, and that's reflected in other figures as well. So young women are less likely to take their own lives than men, and we know actually there's good research about the fact that you women are just better than us at doing all sorts of things. So we know the research tells us that you kind of talk about your feelings more often, or you have better emotional literacy than we do. You have stronger social networks, and you're probably more likely to tell someone when you're troubled by something. So if we know that, we need to probably treat us guys differently, So I suppose, if you're talking to a guy, or you're a guy talking to another guy, and you ask, if you're okay, sometimes we're probably more likely to say, yeah, I'm fine, when actually we're not. And so, it's a simple thing, but probably an obvious thing to ask again. Because asking twice shows that you're kind of willing to listen. You're not really it's not just a sort of social nicety. You're actually interested in, understanding what your mate is going through. And I suppose, some guys might come right out and say then that they're, dealing with this or dealing with that, but many will not. And so there's some other interesting sort of findings about men's mental health. And although we know that alcohol is a depressant and alcohol is not great for our mental health, actually there's some situations in which, like, a guy might be more likely to confide in you over a drink. Yeah, so if you feel like there's something that a male friend of yours is not able to say, then take them away to a different place, like ask them for a drink. And sometimes people will sort of drop little hints, and I suppose it's good to sort of look out for those hints that people might have something more to talk about. And if you're able to create a space that feels safe for them to do that and share what's on their mind, then that's really good. I suppose the other thing about men's mental health is like banter. And I guess it's important to sort of to notice banter. Sort of what's the difference between kind of banter and something that's just not very kind or not very nice. It's sometimes not very easy, or sometimes more difficult with blokes, I would say, as a bloke, to sort of spot when someone is like bantering with you, or when it's actually something else. And I suppose if your jokes or your banter aren't going down so well, maybe like sort of ask a bit about that. And I think, for us guys, it's important for us guys to sort of know that there's no need to sort of be awkward about having these conversations. I mean, I have my male friends. I would say, sometimes we can spend like several hours together and not necessarily talk about anything of any great significance. We can play sport together, or we can be out for drinks, and we come back, and sometimes I do sort of think, well, someone will ask me, oh, what did you talk about? What's happening with X? And I was like, oh, I'm not sure. Actually, we just went out and had a good time. And I think I think men are a bit like that, and I think women are less like that. So I think if women spend a lot of time with each other in a social situation, probably it's much more likely that they talked about feelings or things that are
Yeah, I testify absolutely spot on that. Yeah.
And so I suppose if you are aware that that's a thing for men, then I guess we have to make more effort to ask each other about that and to make sure that we're not sort of falling foul of that. So they're hopefully like practical tips about that.
Well, I think that's really interesting as well, your points about saying, make perhaps with a man, it's good to take them for a drink, because the TED Talk that I saw, this amazing man that's doing this charity for men, he actually has done a documentary on his best friend that he so sadly lost, and he thought the best place to show that documentary would be in pubs, because he said that's where men are. Mm-hmm. He said, you might, that generally mental health, sometimes the support is shown in areas that just women go to more, so he's thinking like that as well, so that's brilliant. Mm-hmm. So and I don't know if you know, Dr. Rogers, but Vitality offer an extremely comprehensive mental health treatment cover and support to our members. We take a very holistic approach. Our core cover includes access to preventative measures, including mindfulness apps, which you've already mentioned, and early interventions such as CBT and counselling with VitalityHealth, Talking Therapies Network. Further, our optimal mental health cover includes unlimited in-network talking therapies, plus cover for outpatient, inpatient and day patient treatment. And I just wanted to say thank you so much, Dr. Rogers, for your time and your brilliant insights. Thank you too to all the advisors for watching, and I encourage you to come again next month and watch Vitality's Clinically Speaking. I'm Claire O'Neill, Head of Clinician Management at Vitality, and you've been watching Clinically Speaking.